Welcome everyone to this webinar, Intro to Problem Gambling in Washington State and Gambling Counselor Certification. Happy to have you here. We will be taking questions in the chat throughout the webinar and some verbal questions at the end as well. My name is Tana Russell. I'm at the bottom of your screen there. I'm the Assistant Director with the Evergreen Council on Problem Gambling. You'll also be hearing from today Brad Galvin. He is the Washington State Gambling Counselor Certification Committee Chair, as well as a certified gambling counselor and supervisor with his own private practice, and Roxanne Waldron, who is the State Problem Gambling Program Manager. With that, I'm going to turn it over to Roxanne to get things rolling for us.
Great. Thank you, Tana. I'm really excited to see people from all over the state. That's wonderful. Thanks for joining us today. As Tana said, I'm Roxanne Waldron, and I'm the State Problem Gambling Program Manager at the Healthcare Authority in the Division of Behavioral Health and Recovery. And we have a couple of key messages that we hope you'll come away with today. The first is that we need more certified gambling counselors in Washington State, especially in the underserved areas. Also, the gambling field is changing quickly, and it's important to stay current with what's happening, especially around legalized sports wagering, online gaming and gambling. So so we're glad you're here today. And finally, we really need to promote culturally relevant, trauma-informed, and evidence-based services provided by a pool of clinicians that are just as diverse as the populations they serve. So right now, we only have around 40 certified gambling counselors in Washington State currently. We also have some in the pipeline and provisional status. There are areas of the state where we don't have any coverage, where we definitely need certified gambling counselors. And a few of those areas are Ephrata, Moses Lake area, Wenatchee, Tri-Cities, Pullman, Colville, Okanagan, Omak, Clarkston, Lewiston, and Forks, and there are some other areas as well. We also need to see an increase in the number of certified gambling counselors that we currently have in served areas such as King, Pierce, and Spokane regions. So next slide, please. Great. I'm going to start us off with a quick overview of the types of gambling we have available in Washington State, the prevalence of gambling and problem gambling among adults in Washington State. So as you know, there are many opportunities for gambling in Washington State. Legal gambling in Washington State was estimated several years ago to bring in at least $3 billion a year with a B, probably higher now, so it does have an impact on our economy. The Washington State Gambling Commission, the Lottery Commission, and the Horse Racing Commission regulate legal commercial gambling in Washington State, and the tribes have their own tribal gaming authorities as well. The legal age of gambling in Washington State is 18. However, some casinos and venues require the patrons be 21 to enter. 18 is also for lottery, pull tabs, pari-mutuel, which is horse racing, and bingo. So here's a list of the currently legal types of gambling in Washington State. You'll see the ones you're probably aware of and used to: house-banked card rooms, tribal casinos, lottery, horse racing, etc. But I want to draw your attention right now to the item at the bottom. Legal sports wagering. That's the most recent new gambling activity to open in Washington State. It opened in September 2021, and it's currently at tribal casinos only. So with the exception of legal sports wagering in tribal casinos, there's no legal online gambling in Washington State at this time. This includes gambling on esports. You can participate in esports, but you cannot gamble on it legally, through video gaming and gambling, online poker, and mobile, any gambling you might do through mobile apps. So next slide, please. So in the summer and fall of 2021, the Healthcare Authority, which the State Problem Gambling Program is within that agency, we conducted an adult problem gambling prevalence study. It was the first one in 24 years. It was last done in 1998. So as you know, the gambling industry has changed a lot since then. So here's the current prevalence rate for gambling and problem gambling for the entire state, entire adult population of Washington state. So the dark blue slice on the right represents the 55% who said they did not gamble in the past 12 months in the survey. That was the past 12 months for the survey would have been summer of 2020 through summer of 2021. So that's obviously during COVID, and some of that time brick and mortar facilities were closed. The green and purple slices together represent the 45% that did gamble in the past 12 months. And this is a smaller percentage than we'd normally expect during a non-COVID year, again, probably because brick and mortar facilities were closed for some of that time. Also, people may have been reticent to go to some facilities that were brick and mortar because of concerns about catching COVID. We also did see a big uptick in lottery sales during that period as well. So the purple slice, as I mentioned, is included in the 45% of people who said they gambled, and it represents the percentage that are at risk for moderate to severe problem gambling or gambling disorder. And that number is 1.4% of all adults. That includes gambling and non-gambling. So this is in line with Oregon's recent study that they conducted on how COVID had impacted their gambling and problem gambling. They had a prevalence rate of 1.5%. So we're very close to that 1.4. So next, we're just going to look at gambling and problem gambling. So we're just going to look at the green and purple slices of this pie. So next slide, please. Great. So this pie chart shows the 45% of adults who said that they had gambled in the past year, including that purple slice that shows the percentage of people who are at moderate to severe risk for problem gambling. So of all gamblers, 3.5%, which is the purple, were at moderate to severe risk for problem gambling or gambling disorder. And this is based on the survey. Within the survey, they received a score of 5 or above on the Problem Gambling Severity Index tool. It's a validated 9-question instrument that was included in the survey. 2 to 4% is the prevalence rate that is generally seen in the literature and in other surveys and studies. So the 3.5% in our state is toward the high end of that. This includes all types of gambling together. So brick and mortar and online and lottery and all of that. But it does not include those who were at low risk for problem gambling. There is a score from 1 to 4 on that severity tool that is not included here. It also doesn't include people who do the type of online gaming that's in the gray area of gambling and gaming and gambling. So they may not recognize that what they're doing is actually gambling, so they didn't identify as a person who had gambled in the past 12 months. So this might include mobile apps where you could pay extra money to level up, and you don't know exactly how far you're going to level up, or to get a loot box or another surprise gift. So if all of those people were included, that purple slice would be larger. Finally, this is one of the most important findings of this survey. We know now that Black, Indigenous, and people of color are at twice the risk of moderate to severe problem gambling than those identifying as white. So it's 6% versus 2.8%. So just to clarify, the 3.5 is everybody together who gambles and is at risk, at a moderate to severe risk. But if you break that up into BIPOC and white, 6% is BIPOC and 2.8% is white. So that's a really important health equity issue that really hasn't been identified before in our state in quite this way. We've also learned that for the 27% of people who gamble online, they have a risk that's more than double that of all gamblers together. It's 7.8% versus 3.5%. And it's 4 times the risk of people who only gamble in brick and mortar venues like card rooms and horse racing and lottery sales. So at the time of the survey last year, when it was conducted, all online gambling was illegal in Washington state. even though more than a quarter of the people who gambled said they gambled online. Legal sports wagering, which opened in the fall of 2021 at tribal casinos, that happened after the survey data was completed. Next slide, please. Okay, so on a positive note, we do have a new tool in our toolkit. On May 1st, the Washington State Gambling Commission launched a brand new statewide voluntary self-exclusion program that all commercial gambling venues must participate in. The lottery also has its own voluntary self-exclusion program that's been going for a couple of years as well. And tribal casinos can join this program. However, many already have their own self-exclusion programs. So they may or may not choose to join at some point. So this program, what's so great about this program is this program now allows people who are struggling with gambling to self-ban themselves from all the commercial card rooms in Washington State in a one-stop location, or they can do it online with a notarized form. This is in the past, they would have had to go to each facility and in some cases that might re-trigger people while they're trying to do something positive to ban themselves from going to the facility. And also it covers all of those commercial gambling venues. So this way, if someone has a moment of clarity and they want to sign up, they can do that for 1 year, 3 years, or 5 years. And when this time elapses, they have to opt out of the program in order to gamble again. So they have to take an active action in order to unban themselves. So this is also a great new tool in the clinical toolkit for providers to suggest to clients who are in the throes of a gambling addiction. But please note that no one but the client, not a family member, not a friend, not a clinician, no one but the client can sign themselves up. That's very important. So as of now, since it opened a month ago, we have approximately 30 individuals in the state who have already signed up. And one person actually who had signed up was caught gambling after they signed up. And because of this new legislation, they had to forfeit their winnings to the state problem gambling account to help fund problem gambling treatment and other services. So final slide, please, Tana. Great. So finally, I want to share some information with you specifically about the state problem gambling program, of which I'm the manager. It was established in 2005 as a low barrier program to fill the gap for people needing treatment for problem gambling, but who didn't have insurance or were underinsured to cover the cost. The state problem gambling program currently covers outpatient treatment for problem gambling. And for people to access treatment, people can call the problem gambling helpline at the 1-800-547-6133 number, which I know Tana will share again, where staff will help connect individuals to treatment in their area. And people can also reach out to the state program, to me, or to the Evergreen Council directly. There's no wrong door. So as for the state program, we also have a list of agencies that are certified problem gambling agencies that we contract with for problem gambling treatment. And that's on our website. And just search for HCA and problem gambling in your browser to find our page. And that list is under resources at the bottom of that page. So it is a low barrier program. So who is eligible? Well, individuals who are assessed as needing treatment and are amenable to treatment, but are uninsured or underinsured for problem gambling treatment are eligible. Family members can also receive treatment with or without the person experiencing the issue with problem gambling. Medicaid status is not a factor. Clients and family members can receive treatment whether they are Apple Health clients or not. Just a side note, Healthcare Authority is working to see if we can get coverage for problem gambling treatment under Medicaid. That's still not certain that it will happen, and the soonest it would begin would be 2024, but it's a very exciting development. We hope that it works out. So I want to thank you for the opportunity to share this with you today. And of course, I have to put in a pitch for, I hope that you might consider becoming a certified gambling counselor, or maybe encouraging someone else in your agency or someone else you know to get certification. So also, please feel free to reach out to me directly directly with any questions about the state program or anything I shared today. And I'm going to turn this back over to Tana. Thanks so much.
Thank you very much, Roxanne, for getting us going. And everyone, I hope that you have a screen you're looking at right now to answer a couple polling questions for us, because we're about to start talking about the treatment, training, certification side of things. And so you should see a polling question. I already see people answering it. It says, what degree of problem gambling / gambling disorder training have you had before before today? None. This is my first, minimal, a little training, or maybe it was a very long time ago, because that is the case for some. Moderate, meaning no number there, but you feel like you've had a few. Or advanced is you've at least had one of the core 30-hour in-depth, deep dive core training programs on problem gambling, or maybe you are a certified gambling counselor already. I know a few names that registered that I know are certified. So it looks like we've got 88% responses, which is great. Great. Thank you very much. I'm going to end that and share those results with you. And so that's fantastic. It looks like most of the people here today, this is your first. Bravo. This is like the best first training you could get. We're going to tell you about some other things available to you, and you can pick which direction you want to go from there. And some of you have had a little bit. So great. We've got a little bit of the spectrum here, and I'm going to share one more polling question with you, which is about problem gambling experience. I said to someone not long ago, when people sign up to take a training that has gambling or problem gambling in the title of it, it's often for a reason. There's usually a reason people choose to seek out these trainings. And sometimes that's about experience. What has been your life experience around problem gambling and gambling disorder? Is it A, personal? You know someone who's been impacted. Could be yourself, family, friend, coworker, something like that in your personal life. Was it in a professional capacity? Meaning in your current or previous profession, you encountered a client, a patient, someone you worked with, was not part of your personal relationships that might have been dealing with some gambling related harms. C is both, and D is none, and none that you know of. But based on how prevalent these things are, it's kind of like tobacco and substance addiction these days, in the sense that a lot of people do know someone. They might not necessarily know that that person's struggling, however, because it doesn't exactly come up in conversation all the time. So we've got another 88% responses. Great. I'm going to end the poll and share those results. And so we've got kind of a spread here. Some with personal experience, some professional, some both, and a few with none. Great. I want you guys to notice that most people have never had training or very little, and yet also most people have experienced it in some form. Very few of you said none at all. Almost everybody said some form in my life I have experience around problem gambling, and yet very few have ever been trained on it, because the training is not as available out there. This is a topic that a lot of people recognize there's an issue. They might recognize a gap in their education background around this topic, and they seek this out for themselves. So bravo to you all for doing that. And I'm going to stop that poll and give you a little bit of just a very broad, high-level overview. So help services for gambling in Washington basically are just like the coverage for substance use services, just fewer of them. There is prevention, there is treatment, there is recovery services, all of that. There's just not as much. There are prevention programs for problem gambling, is maybe youth-focused kinds of programs, campaigns, education curriculums, responsible gaming training, including the RG Star responsible gaming staff training resources we go and do at casino facilities. It's more on the prevention spectrum. There's treatment, both at facilities, people in private practice, there's tribal and non-tribal programs, there's family services, individual counseling, group counseling, financial therapy, etc. Financial therapy, is a little bit unique. You don't often find that in SUD kind of treatment programs, but you do for gambling. So that's a little bit unique, but overall, they're very, very similar in the types of sessions or appointments a person might be able to find. And of course, recovery services, there are 12-step groups like GA and Gam-Anon. There are online support groups, a whole variety of those. Recovery cafes and centers are very welcoming to people in recovery from gambling. There's even podcasts and social media groups and all kinds of resources. And I really encourage people to think outside the box of just treatment, because those other resources are available 24/7. A person who works Monday to Friday, 8 to 5 is not available 24/7. So it's nice to have things in your resource list toolbox that are around the clock kind of things people can access. Someone says I'm cutting in and out. So I'm going to sit a little closer to my microphone and hope that that fixes it. Now, like I said, it mirrors SUD services, except there's fewer of it. So there's only about 35 to 40 certified gambling counselors in the whole state. Compare that with about 4,500 active SUDPs and over 20,000 LMFTs, LCSWs, LMHCs, psychologists, all of those, right? So there's just not as many people trained and specialized to treat this. There is no residential treatment center for gambling in our state currently. That has not always been the case, and we hope to have a residential program again soon, but we have a lot of residential SUD programs in our state. None for gambling right now, though we do have funding to help send people to some of the out-of-state facilities. Private insurance does cover gambling treatment. There is state funding, tribal funding, ECPG funding. Medicaid does not cover gambling treatment right now. There's no federal funding for this. So there are some differences there. So, quick tips. One thing that you can take away from this training and put to use starting today, starting tomorrow, is a few things you can do to be helpful to help seekers or people struggling. Number one is adopt an attitude of compassion toward those dealing with gambling related problems and harms. So often I run into people who think gambling isn't a big deal, or it's not very prevalent, or it's a behavior that people should just be able to stop. And if you say anything like that to an individual who is struggling with gambling related problems, you've just told them that they are not safe to talk to you about it. So you want to adopt an attitude of compassion. Gambling is very prevalent in our state. Gambling problems are very prevalent in our state. And to have an attitude of compassion can actually be helpful to set that safe space for a person to know they can be real with you and that you'll do what you can to help within your capacity. The other thing you can do is educate and integrate. If you don't know how to educate people on how to gamble safely, how to make decisions about their gambling, what they can teach to their children about gambling, signs of problem gambling, we got you. Check our website. We've got all kinds of resources and fact sheets. Check our YouTube channel. We've got all kinds of YouTube videos you can use. You don't have to make anything up. You can use the resources we have to help integrate education into the people you're already working with, just to generate these safe space conversations around problem gambling. And so I've included some links on the screen here, and someone asked in the chat, and yes, these slides will be made available to you afterwards so that you have these resources. And of course, the easiest thing to do is screen and refer. You don't have to be a certified gambling counselor to use one of the validated screening tools. You can download them from our website. They're out there for free. There's several out there. Provide the screening to your clients and provide a resource list. Very, very simple, low barrier. We can do a whole training on screening best practices, but essentially just making the screening available and letting the tool do the work and the resource list available is a whole lot better than nothing. And obviously share the helpline. The helpline is like the one-stop shop, lowest hanging fruit, easiest resource because it's available 24/7. People can call. They are referred to a certified gambling counselor by location. But again, that's not the only help resource. There's also GA, and there's Gam-anon, and there's online things, and there's the recovery cafes, and there's podcasts, and there's all of that other stuff as well. Don't forget about. So screen refer. Here's your screening tools, the brief ones you might want to choose from. They're all on our website in the resource and downloads. And here's your referral list. The helpline, our website, the state problem gambling program website, the list of certified gambling counselors, GA, Gam-anon, staples for a resource list. You could print this slide right here if you wanted. You can make your own slide that looks pretty for your agency, whatever you want. I've given you a start of a resource list for problem gambling that you can use to help make those referrals for individuals. And the idea is to give them options. Not everybody's going to want to see a counselor. Not everybody's going to want to go to GA. So you want to give everybody all their options so they can choose what is right for them. All right. And someone asked if the GA is a 12-step. It is 12 steps. Not 14 steps, but it is 12 steps. Yep. All right. So now we're going to move into a little bit about the certification piece, just in case you are interested or wondering if maybe certification as a gambling counselor is right for you. And we're going to have Brad Galvin, who is our committee chair, talk to you about this process.
All right. Well, it's good to, let's see, am I on the main screen here? Good. Okay, I'm seeing a nod. That's good. So yeah, it's good to see everybody. I'm really impressed actually that so many of you, this is your first or one of your first exposures to the gambling field, and how big of a turnout we had today. And I'm so grateful to be able to work with Roxanne and Tana, who I've gotten to know pretty well over the years, and just their level of expertise. I would highly recommend any questions that you guys have, just to reach out to them. They're on their game and they know a ton of details. And so I'm really glad that everyone's here. And so for me, yeah, my name is Brad Galvin. So I have a background in mental health, substance abuse, and I'm also a gambling counselor, certified gambling counselor. And I've been involved in creating some curriculum for some different programs around treating gambling addiction. So one thing that I've learned in that process is we really need to connect with what people need. And so, you know, someone comes in and we kind of know a little, or we're not totally sure about it. We're not that confident. And often people with gambling disorder, they're in a place where they're like, look, I feel like I'm bailing early because I told myself after the next big win, I was going to stop, period. So they're often on the fence. And if we come in and we're a little bit on the fence about our skills, that can kind of get in the way. And so one of the nice things is people come in and we're like, cool, I'm glad you're here. We understand some of the basic issues, which for me, one of the biggest things I learned, and I often present on this to substance use groups, is, you know, when we look at, okay, that folks with gambling disorder have the highest suicide rate of any addictive disorder. That tripped me out. What also tripped me out is what's happening in the brain on a molecular level is just like other, we'd say, well, drugs of abuse, other addictive behaviors. And so, you know, we understand, oh, wait, this is not a personality issue. It's not a lack of discipline. It is actually an addiction that has its own withdrawal symptoms. So there's so much to it. And so by going down the path, I know it often helps me to be motivated. Okay, look, I need to get my 60 hours in. I need to get my 30 hours in. Now I'm going to take the next step. If I'm on the fence, maybe I'd rather take vacation. I'd rather do something else, but I know that's going to help my clients. And so by getting the certification, it takes that little squirrel in my brain out of the process of decision-making. And I know, okay, I'm going to bring my A game here, because I need to, and also because it's for the best for my clients. And so you can't fake confidence. I mean, you can try to, but people will be able to tell if you get them or not. And so this training is super important for that. And one thing also is that the WAC, the Washington Administrative Code, actually requires you to have a certification if you're in an agency that they support, which is most agencies, in order to treat gambling disorder. So it's also a necessity to have that. And again, having credibility with your clients, they're going to know if you get it or not. And really, experience is the primary thing that's going to help you get it. But being around other people, folks you can ask questions to, that's a big part of having this and having a peer network where you can have that kind of support and not feel like you're out on your own. I know for some years I was involved when I was working up at Lummi on the intertribal providers group, and it was different tribes from around the state, and we'd all meet once a month. And even during COVID, we would still meet just virtually, which was great. But often you can feel like you're in a silo, and part of that is because there are only 35 to 40 of us in the state that are certified. It really can feel like, yeah, we'll talk about gambling later, but let's talk about drugs and alcohol. Yeah, we'll talk about that, but let's talk about, depression, anxiety. And really having this community has been super important. So those are some reasons to become certified. You can go to the next slide, please. So here are some comparisons. So you can either get certified at the state level, or you can get certified at the national level. So that's the IGCC-I is the national level. International level is what the I stands for, but for our purposes, it's national. So you'd be looking at some requirements. Again, for state and national, it's the same for level 1, bachelor's, or equivalent for both. So the equivalency would be, say, having an AA degree plus a certain amount of experience. State licensure, obviously in Washington State, you need the Washington State licensure. For the training, it's 30 hours for both. However, one of the things that we really pushed, and this felt like much needed, and also in response to just a greater awareness that's come out over the past couple of years of like, we really need this cultural competency piece. And so this is something that we've added. Now you will get 3.5 hours of credit towards your 6 hours of cultural competency doing part of the core training, which is that 30-hour core counselor training through the Evergreen Council on Problem Gambling. So that's a nice additional piece with the Washington certification. So both of them require 100 hours of gambling counseling experience. That doesn't mean just one-on-one experience. Often people say, how am I ever going to get that? It includes that, but it also includes documentation. It includes the screening that Tana was talking about. So doing groups, I've done a lot of presenting, like I mentioned, to substance use groups because it's a way to get the word out about gambling counseling. All of that stuff counts. Writing up your progress notes counts on a gambling client with gambling disorder. So just so you know what that 100 hours comes from. And then also another difference is that you need 8 hours with a supervisor, one-on-one, or group supervision. Tana, can you chime in here? Group supervision's allowed as well as part of that 8 hours, am I right?
Yes, absolutely. Okay. And reimbursable up to, I think, 4 people in a group session. Of course, the gambling supervisors create their own rates for their supervision, but they can do up to 4 people at a time. Yep.
Awesome.
And it doesn't have to be in person. It can be on Zoom. As long as it's HIPAA compliant for any kind of client info, virtual is fine.
Yes. Yeah, exactly. So that's really an important piece. And again, that was another thing that was, I think, a positive that came from this kind of COVID experience. Was, this opening up to having virtual allowed as well as for getting your supervision hours. And then it's $50 cheaper to get the Washington, the application fee is $50 less for the Washington level 1 application. Next slide, please. So level 2, this is actually where there's a fair amount of difference. Same thing in terms of bachelor's or equivalent, state licensure. There is 60 hours of training required for both. So those are basically the same. Again, the 6 hours cultural competency is one difference between Washington's level 2 and the international level 2. A key difference though is the number of hours required for it. So it's 2,000 for the international level 2. For Washington, it's 300. And why I like that, even though I do have the level 2 with the international myself and then the Washington supervisor credential, I like that because it shows an additional commitment without having to go from 100 to 2,000, right? So there's an intermediate step. If you want to go to the 2,000, that's the number of hours you need to be a supervisor in Washington State. So I like that tiered approach. Plus the 100 hours that you did as part of your level 1 counts as part of the 300 hours. So that's nice as well, because then you're not starting at 0, you're starting at 100. So really just 200 additional hours and you have a level 2, which again, just shows your peers and shows your clients that you just have a little bit more experience, a little bit more commitment to it. And then in terms of the requirement for hours, it's 24 hours supervision for the level 2 for the international, and then 15 hours, because it's a 1 to 20 ratio, it would be a minimum of 15 hours of supervision to get your level 2 in Washington. And then the application fee is cheaper to get the level 2 in Washington as well. And I'm not trying to sell Washington. Like I said, I'm, as the chair of the program, I just want you to know, I did get the international. We can certainly talk about the pros and cons, but I like the key thing for me, if I were starting from scratch, why I would do the Washington route would be so I could get my level 2 at 300 hours if I ultimately chose to do that. Okay, so other certification requirements. So you'll need letters of reference from coworkers and your gambling supervisor, which is not necessarily and probably would not be your on-site clinical supervisor, although it could be. So you also need a signed statement from your online clinical supervisor and verification of the clinical experience, signed application, ethical standards, et cetera. Passing score on the certification exam for gambling counselors. So we worked a long time in our committee, probably 1.5 years altogether. Well, at least a year, I'd say, in term from the time we first thought of it until the time it was finished, to come up with an equivalency, because we really have focused on wanting to throw a wider net. There are people who will not even go down this path, and you might be one of them, if you thought at the end of this, I have to take a 4-hour multiple choice exam. Me and exams and I are just not friends. So what we did is we're like, look, what are we actually trying to figure out? We want to know that someone can sit with a client and do a good job. That's the bottom line. How well can this person help this person in a sensitive way? And so we came up with an alternative where you would have a case conceptualization where you could use an actual client or even a theoretical client, however you wanted to put that together, and go through and say, okay, these are the things that I'm looking at. These are the things that, are, important for me when I'm looking in these different categories of this person's life. All the different psychosocial things, like what you'd look at when you're creating, an assessment, substance use disorder assessment, or a mental health intake, all of those kind of same things, but it's not the same because it's gambling, right? So you'd be showing your expertise in that area. So we're really proud. We spent a lot of hours on it. So that's a nice thing. If you're doing the Washington, you have that as an option. And then paying the application fee, and then proof of liability insurance, which for most people, you would have that as part of your agency. In private practice, I have to pay for it myself, but most folks, you would have your own through your agency. So other international gambling counselor certifications is the co-occurring gambling specialist. There's also a certification they have for clergy and lay ministers, a gambling disorder trainer certification. So that's where they would do train the trainer so that you could become a trainer. And then the International Gaming Disorder Certificate. Sorry. So what's cool about that last one is that we're really seeing more and more the overlap between gaming and gambling. And so if this is your first introduction to the field, you'll see that more and more because there are gambling aspects to gaming. And an example of that would be like loot box. You might pay a certain number of credits or you get to a certain level and then you hit you open the box and you might get something that's not that great, but you might get really lucky and get the super fancy wheels. I know because I have a 13-year-old son and once in a while I get something fancy and I don't know what it is. But anyway, so that's definitely a thing. And video games are massive, especially with the youth. So having an understanding of that is also very important. And it is something that we're looking at within our own committee to make a bigger and bigger part of the work that we do. So look for more on that in the coming years. Okay, so I believe that is it for me. The one piece I did want to add is just that part about Evergreen having training for these 2 credentials. So the gambling disorder trainer certification and then the international gaming disorder certificate. And we have some wonderful experts within the gaming field in Washington State. So Hillary Cash and others at Restart. So this is really, we're in a cool place. I mean, yes, we have Microsoft and Google and all that over here, but we also have folks who are really skilled at treating this. So that's another route that you might choose to take to add to your skill set. So I will pass it over to Tana, and feel free to reach out to me. I'm at Brief Therapy Works, and you can reach out or through Tana if you'd like. I'm happy to share if you have any questions after the session. Thank you.
Excellent. Thank you, Brad. We've also had some great questions and answers and resource sharing in the chat. So please keep that up. We're here to help any way we can and get everybody pointed in the right direction for you. We had a few questions about the Gambling Counselor core training, which I'm going to tell you about now. In the pandemic, it shifted a bit, and then now we're making a shift out of the pandemic. So before the pandemic, it was 30 hours, all in person, always in person, twice a year. In the pandemic, we had about 5 months to shift from 100% in person to 100% virtual. And so we divided it up into 10 hours self-directed, self-paced content that opens about 35 to 45 days before the live content, which will be the remaining 20 hours. And so it was 100% virtual during the pandemic, but a lot of people really missed that in-person interaction, particularly with a lot of the skills practice and group exercises that we do. So moving forward, it's still going to be offered twice a year. One of those will continue to be 100% virtual with this 10 hours self-directed, 20 hours live in a webinar format. The other each year will have a little bit of an in-person component. So hopefully the best of both worlds for as many people as possible who with different learning styles and availability. The next one coming up is July 11th to 13th. It'll have the 10 hours self-directed open now. People who are registered are already working on that. And then they'll come together in July for the remaining 20 hours in person, where we do a lot of skills practice and interactive learning and things like that. So it is open to everyone. Let me be clear. The certification itself, like Brad said, does have some prerequisites as far as licensing and education goes, but just to attend the 30-hour training, you don't need any prerequisites. If you're interested and you want to deep dive, you are absolutely welcome. We get peer and recovery coaches, we get prevention specialists, we get people who work for the casino and the industry who attend, we get interested family or advocates who attend. Please do. It is open to all, so you can find more information there. Also, if you're not sure if you want to do the certification or you want some more training, there is another free webinar coming up. Today's webinar was in partnership with the Healthcare Authority. On June 23rd, we're doing a webinar in partnership with the Northwest ATTC. If you're not familiar with the Northwest ATTC, I really encourage you to look them up. They do a lot of trainings and have a lot of resources for people in the behavioral health field in Alaska, Washington, Oregon, and Idaho. So great resource. And that one is going to be 3 hours all about gambling disorder. So straight out of DSM and ASAM content, all about gambling disorder, the non-substance related addictive disorder and why it's called that and what the diagnosis criteria are and all the ins and outs. So if you want a deeper dive about gambling disorder in a free webinar, you can attend that one on June 3rd, but really the 30-hour will give you the most broadest and most in-depth content, more content than you ever thought would be possible about this. And yet, by the time people finish, you're like, oh my gosh, there's so much more I still have to learn. Yes, there is. You can literally continue to learn in this field to your heart's consent. Heart's content is what I meant to say. Anyway, So for other problem gambling education, you can visit our website. We've got some resources there. You can visit our training page for all trainings and also our Connect page, which are some other resources available to you anytime. Read will get you to all of our blogs and a bunch of blogs that correspond with the different live streaming episodes we've done. Listen will take you to our podcast. Let me go to the next one here. There we go. So our podcast is called the Connections Healthy Gambling and Gaming Podcast. We've got 3 seasons now. It's been going on. It's on its 3rd year. All things related to problem gambling and gaming. One of our latest episodes is an individual from Australia who shared his story of recovery from betting on American sports betting and other things. We recently had someone come on and talk about her journey as the parent, the mother, whose son had a gaming disorder, and watching her son go through the video gaming addiction and the decline and how she recovered from that, what she did to heal. Stuff on the social casinos and all kinds of stuff. Anyway, it's good. And then we have 2 live stream series, ECPG Live, all things related to problem gambling and gaming, and Kaleidoscope, Reflections of Diverse Views on Mental Health Equity, which is all things related to equity and social justice in our behavioral health field. So we have a number of experts who come on these shows and share their experience. They're not trainings, they're not CE credits, they're just discussions and getting these important things out there and in people's minds. Low barrier, they're all on YouTube. You can watch them anytime, whenever you would like to. So you can check out those resources. And some of those are really great with clients as well. Please preview them to determine, is this just for me? Do I want to share this with my staff or my team or my clients to determine what's appropriate? But yeah, good in group tools as well, I'll admit. If you go to our website on our awareness, resources, and downloads page, that's where you're going to find all the screening tools I mentioned, the fact sheets, the last prevalence studies are up there. When the new one is finalized and published, we'll make sure we try to get that available to everyone as well. So lots of resources you guys can access. And of course, there's the helpline. We've got a number of different materials, a Spanish helpline brochure, different culturally relevant types of helpline materials. You can call at any time, etc. So questions. We did have one question in the chat. I told someone I would talk about verbally real quick. I put something in the chat, but I'm gonna mention it here. Someone asked about gambling withdrawal. Thank you, Eric, for asking about that. Yes, gambling disorder has withdrawal symptoms, just like substance use disorder has withdrawal symptoms. And I tell people, if you don't think a behavior has withdrawal symptoms, if you have ever taken a cell phone away from a teenager, you may have seen some withdrawal symptoms. Okay, irritability, restlessness. Yes, behaviors can be addicting and behaviors can have withdrawal symptoms. Gambling's no different. It comes with restlessness and irritability. It can include trouble sleeping, headaches, digestive issues, panic attacks. People can actually be going to see their doctor to figure out why they're sick when it's actually gambling withdrawal. Those programs that do residential gambling treatment will sometimes detox people when they first come in. Yes, absolutely, it is a thing. Thank you for asking about that. All right, well, we are right on time. Bravo, everyone. Thank you very much. I hope that this was helpful.